Good evening, everybody. It's my honor and privilege to be here this evening. Thank you to IAOH for putting all of our focus on this very important topic. And thank you all for being both physically and mentally present this evening. We're in the midst of a silent epidemic of non-communicable diseases. While we may not realize that we are, every one of us is aware of individuals who have succumbed very silently and suddenly to cancers, heart attacks, well before they should. 65% of the deaths in India in 2019 are attributable to non-communicable diseases, diabetes, cholesterol, cancers, and so forth. This number was 25% in 1990. So it's grown from 25% to 65%. About 60% of Indians have back pain over their lifetime. Either we ourselves or someone we know very close in our own household has back pain. And 90% of that is related to our occupation, right? Much of these chronic conditions are related to our lifestyle. Much of our lifestyle is related to our jobs. We sit too much, we eat too much, we stress too much, we don't sleep enough. Our brain gets too many signals. Just think about how much stimulation we have in the room right now, right here today. Our brain is, after all, just like our computer, has limited storage capacity and processing capacity. When it's overloaded, we know what happens to our computers. The same happens to our brains. And all of this affects our health. I have for you 3 suggestions for improving workplace health. 1, standing. Perhaps we can take a minute and stand. Right now. I'm sure you've heard sitting is the new smoking. Do you know why? 30 minutes of sitting slows down your metabolism by 90%. Okay? And you've all been sitting for 30 minutes. We have had the privilege of standing and walking and standing and walking, but not you all. Thank you very much for indulging me. Please have a seat. And if our metabolism slows down, essentially the food we eat doesn't get digested well enough and accumulates around our bellies very easily, and around places where we don't want it to accumulate. So have standing meetings at work. They're very, very efficient, trust me, because people don't like to stand so much, so they say what they want to say and they leave the office, right? Do one-on-one walking meetings around the office, around the campus, on the factory floor, right? Usually 15, 20-minute catch up with a colleague, doesn't have to be sitting again in the office. The second suggestion, food. I think we should take inspiration from what we saw with Indian Oil today, with their canteen hygiene index. Many of you employers offer good food and canteen facilities to the employees. I think we have a responsibility to make that healthy. Healthy does not mean not tasty. Healthy can be very tasty. We just need to find the people who can make it tasty. Let's start with actually cutting the sugar in our teas and coffees that come around by half. Let's pledge to do that for 1 year. And then the next year, cut it by another half. Because as Indians, we actually consume almost 5 times more sugar than our body actually needs every single day. So start with that sugar in the beverage that comes around in the mid-morning and the afternoon at the office. The third is health checks. At Apollo, our chairman declared to the board that every hospital employee and their spouse will have their annual health checkup sponsored by the company. And we've been doing this every year. And when I say health check, I don't mean just check the box and get a bunch of blood diagnostics done. That is not enough. How do you measure lung function with a blood test? And in a post-COVID world, lung function is exceptionally important to measure. How do you measure heart health without a blood test, with only a blood test? It's not enough. One ultrasound, a doctor told me, can detect up to 20 cancers. It suddenly makes waiting for that ultrasound worth it. So please think about the health checks comprehensively. But at the same time, I think the trick is in getting it personalized. Every one of us is different. Every one of our bodies is different. Every one of our exposures at work is different. How does one size fit all? How does one corporate have one package, simply cut by age? Understanding what your employees are exposed to, curating packages that then test that, is very important. We worked with one employer who had 18 package combinations, 18. Of course, it was hard to execute, but I truly admire the thought behind that. Until not so long ago, and even now in the audience, we wore masks for prevention, right? Nobody liked it. I didn't like it. It felt very claustrophobic. But we had to, and we did. Health checks are like that. Nobody wants to do it, right? But I think it's time that we actually make it happen for everybody. Preventive health is unfortunately very, very hard to touch and feel and see, right? Everything that's going on inside your bodies is very intangible. It's hard to actually understand what's going on until it's a little too late. ये तो कल का problem है, आज का नहीं है. But as a society, we've started actually saving for retirement. In order to enjoy that retirement, I think we also need to invest in our health, to be healthy enough to actually enjoy that retirement. It is our responsibility to help every one of our colleagues, our employees, to realize that we need to take our health in our hands today, else we will all collectively suffer tomorrow. And as employers, we have this responsibility to our employees, to our companies, and also to our country. Thank you.